how's birth been so far, Dal? You enjoyed it?
Oh, I haven't enjoyed it.
You're doing great, and feels like over halfway through, I reckon.
Yeah.
So we think she'll be here soon, don't we?
Well, you do.
I do. Maybe first thing in the morning.
Yeah, hopefully. I'm expecting tomorrow. I think if it's not tomorrow, I'll start to get annoyed.
Yeah.
I'll start to demand a C-section.
Demand to see the manager. Hi everyone, welcome back to Safe Space for part 2 of our birth story as we welcome Anna and Luna to tell us a bit about, well, we were up to the bit from just about the birth, I think.
Yeah.
But before we get started, again, just to reiterate that us talking like this is in no way meant to scare anybody or sway anybody's decisions. Everybody's experience will be different, and we just think it's really important that all stories get to be shared, including more complicated ones, and hopefully people watching this will realise that even the most complex can be positive too.
I think that's the point, is that pretty much everything that I was scared of happening did happen, and I guess even though it was scary, I'm fine. So whatever happens, you will get through it.
Yeah.
And this is kind of a bit like therapy, considering that's just goes to show how stretched the NHS is that she's nearly 10 weeks old and I'm still yet to receive any trauma counselling or support, despite referrals going in. So this is our form of therapy.
Yeah, exactly. And if anybody have any questions, we've already got a few questions to pose at the end, but if anybody's got any more questions for Anna or me, then by all means pop in the comments or send them through direct message and we will get back to you for sure.
Yeah.
But without further ado, shall we?
Yep, so where did we get up to? So we just...
We
were about to go in for the C-section, weren't we? So
the morning of the 5th, wasn't it?
Yes.
Early
hours. Yes. So so they obviously decided that the C-section was the best way forwards, and that I was relieved at the time, although C-section maybe before sounds like quite a big scary operation. I'd just been going for so long, and for me things like sort of forceps and I've forgotten what the suction thing's called.
Vacuum, is it?
No, it's again with a V, but I don't think it was vacuum, but something similar. That wasn't an option for me, really. I was really, really terrified of that. So I was relieved when that choice was sort of taken out of my hands a bit, really, and they said let's do the C-section, and at no point was I scared. Obviously I was apprehensive and I was nervous, especially when they're sort of checking to see if they need to change your pain relief, to see if you're still numb from the epidural, and I was thinking, God, I don't think I can feel they're spraying you with this cold stuff, saying can you feel that? I was like, I don't think I can, but God, what if I can? But yeah, it was absolutely fine. The staff were absolutely amazing, weren't they? They were.
We've seen so many of the different midwives and nurses over the hours.
Yeah, and especially the team who were involved in the C-section were just absolutely brilliant. They were funny, professional.
The anaesthetist
was absolutely brilliant. He was sort of up my end, and he said, anything you need, anything you feel, tell me straight away and I can do something about it. And he just kept just popping in my little syringe thingy, popping different drugs in and stuff, telling me what was going on. That's to stop you from feeling sick, that's to stop you from shaking, that's to stop you. They were brilliant. And it didn't take very long at all.
What was it, about half an hour?
Half an hour, yeah.
To get her out, and then another half to
sew me up, yeah. I remember looking at you and just, I could sort of feel things, but I couldn't feel anything really, and I just remember thinking, I hope she cries, I hope that she's okay, and suddenly I just heard this cry.
Yeah.
And we both looked at each other and were like...
Because we'd set ourselves up, because they say that with C-section babies sometimes
They're a bit
quieter
sleepy,
because they haven't gone
yeah.
through the birth canal. It takes them a while to wake up to the world, but straight away we heard
Straight
that
away
voice.
she cried, and I said, "Oh, that's the best sound in the world." And the anaesthetist went, "You won't be saying that in a few days." Yeah. And then they brought her around to show me her before they sort of took her away and sort of cleaned her up, and you went, didn't you, and cut the cord and everything. And
Yes.
and then they sewed me up. You were left with her on your own for
They
a
took
bit
me
in the
into
room.
a different room with her, and then they sort of watched me change the first nappy, and then they went, "Right, well, we'll leave you to get to know each other then." And I was like, "What? You're going to leave us alone with..." Oh. It was scary.
And I was being sewn up, suddenly felt overwhelmingly sick, so I was
Yeah.
trying really hard not to throw up whilst being stitched up, which was really difficult. And then, to be honest, when we got back to the room, I mean, I remember, and I think it's totally fine to say this because I think everyone must feel some level of this, but I remember just being a bit scared of her, actually, and just being a bit like...
She's so vulnerable and
I
delicate.
don't know how to look after you.
Also, you must have been completely...
I was knackered, and
Yeah.
then they were doing the change of shift for the midwives, and so they were really busy, and it was like, I need help, I don't know what to do, and and they let you stay for quite a long time, didn't they, that day?
Yeah, I think I
You
stayed
didn't
for
go
about
on till
4 or 5 hours after you got out of... Was it in
No,
the day,
it was a long time. You were
Right.
there till about
Oh, it was
4,
until you went back onto the
Till I
labour
went
ward and they
to
kept hold of you
postnatal.
for a little bit, didn't they?
Yeah. So they kept us in labour ward for a bit because my temperature had gone really high just before I went into theatre. It had gone up to like 39 degrees, hadn't it?
Yeah.
And so I instantly thought I had COVID, but they were like, "There's no way you can get COVID here. It's a sterile environment,
And they all
you
had
had
so
3
much,
COVID tests."
They all had so much PPE. They were taking off multiple
Yeah.
aprons and gloves, and there was
Yeah.
no way. But it was the obvious thing for you to freak out about.
Yeah. But then we were. It just meant that I had an infection. They weren't sure what it was, and so then. That's why we had to stay in hospital as well as the C-section recovery. It was because we needed to be treated with IV antibiotics, both of us. So she had this massive cannula in her tiny little arm, and I had this cannula. I mean, I'd had a cannula in for days, hadn't I? And it was just... And then I asked for it to be changed because it was just really not very nice. Yeah. So then got to the postnatal ward. That's when you went home. Got there at tea time, and I'd already sort of asked for if someone could help with the breastfeeding because it was such a rush after she was born that the midwives were really rushed. They were trying to write up all their notes and they were like, "Yeah, she's fine, yeah, she's on, that's great." And I kind of felt like, well, not really, I don't really want to just take that as gospel. And so I asked quite a few midwives when I first got to the postnatal ward, "Please can you have a look, please can you watch, how does it look?" And they said, "Yeah, she's on fine, she's feeding fine." And I said, it doesn't feel right, it hurts quite a bit. And I remember one midwife saying, "I wouldn't do anything differently at all, your technique is good, her latch is good, you've got her in a good position, I'd just keep at it, it might just be that it feels a bit different." And I thought, okay then, right, we'll just carry on with that. And then through the night, I kept trying. So the first night on the postnatal ward, I kept feeding her, and she just kept getting really distressed, and she'd seem to feed for a little bit and then come off. So I thought she was full, but then she was crying again, and I asked again. I asked midwives to come and have a look, and they said, "Yeah, that's fine." And then throughout day 2. I was really, really, really sore. It was really painful. I couldn't bear to feed her. And I asked again. There was obviously a different shift of midwives, and they suggested like different positions to try. And so that was quite difficult because I'd been told the day before, "No, that's perfect, your technique's perfect, the positioning is perfect." And then the next day being told, "Well, have you tried this one, or have you tried this position?" And I just felt like I was trying all these different things that different midwives were suggesting, and none of them were actually working. And it was then that I started to get a little bit worried and a little bit upset, really. And I think it was really that night in hospital that got really bad. It was long. I was like we've already said, we had so many midwives who were all absolutely amazing. Unfortunately, I had quite a negative experience during that second night on the postnatal ward, with a whole shift of midwives essentially. And I remember she was crying, she was screaming. I couldn't get her to feed very much. It was really hurting. I was bleeding. It was really painful. I knew something wasn't right. I kept ringing my buzzer, and midwives would come in all through the night, 2, 3, 4 o'clock in the morning. And I just got the distinct feeling by the end of it that I was just being dismissed then. I knew something wasn't quite right. I kept saying, please can you check this? And I remember one midwife coming in, basically forcing Luna onto me and being like, yeah, there you go, she's feeding, and walking out. And I just sort of thought something's not right. And then I didn't want to ask for help. So then I was stuck for the rest of that night, not being able to feed, her obviously starving, not knowing how to help her, and being too scared to ask anybody. And so when it got to day 3, I didn't ring my buzzer once. I didn't ask to see anybody. I was scared to ask anybody. And it was when this one midwife, I can't even remember her name, but she was lovely. She wasn't actually on my ward. She just popped in for one reason or another, and she popped in, and I was basically sat on my bed crying all day. And she came in and she was like, do you want a chat? And I just sort of shook my head, and she said, you don't look okay. And I didn't trust to speak to them, because I just thought, if I don't get the hang of this feeding, no, they're not going to let me go home. Which is ridiculous, because of course I could go home. And if I'd have said to them, give me a bottle, this isn't working, they'd have given me a bottle and it would have been fine. But I felt like I had to breastfeed her. And I felt like they weren't going to let me go home if it looked like I couldn't do it. So I didn't want to speak to anybody. But then she was lovely, and she was persistent, and I sort of said, I know something's not right with her feeding, and I feel like I'm not being listened to. And I don't know what to do now. And she said, I'll get a feeding coordinator to come and see you. I'll get one of our, someone who's really specialised in feeding. So a few hours later, this lady came to see me, and she said, she said, I've looked at your notes, I've spoken to the midwives, they're all happy that she's feeding fine, and that you're feeding her okay. And I said, but it shouldn't, I'm sure it shouldn't hurt this much. She keeps coming off, she keeps crying, she's obviously still hungry, and she's not getting what she needs. And she said, well, let's have a little look at her, because sometimes there can be a restriction, which can mean they'll struggle to feed. Had a look at her, and she said, yeah, she's got a restriction. So I think, she looks like she's got a tongue tie. And I felt so let down that if someone had just listened to me 2 days ago, it might have been sorted quickly. As it happened, this was the Thursday. Nobody was in the feeding clinic on the Friday, and they couldn't see me the same day, so I couldn't get this tongue tie sorted before leaving hospital. I think really that destroyed our breastfeeding journey. Really, I don't think. Well, I tried after that, and looking back, I I was reminded, trying to breastfeed her just reminded me too much of that night in hospital, and just feeling like I wasn't being listened to and feeling like nobody would help me, and knowing that I was right. So during that last day on the postnatal ward, or what would be my last day, they helped me to cup feed her, and to syringe feed her, and they showed me how to use the pump, so that she was still getting some breast milk, but feeding her it from a bottle, until we could sort her tongue tie out, which would hopefully mean she would feed effectively. One of the midwives came to me, the midwife in charge, and I just can't thank her enough for this, because I think this is just what I needed. She sat down and she said, if I told you could go home now, which you can't because I was still being treated for an infection, she said, what would you say? And I said, well, obviously I'd want to go home. And she said, I can discharge you without a clear feeding plan. So I can't discharge you cup feeding and syringe feeding and doing this combination. You know, you can pump and feed her from a bottle, or you can be bottle feeding, or you can be breastfeeding, but I can't discharge you until I know that we've got a plan. So you need to decide, you know, what. And she said, you know, a fed baby is a fed baby, and that's what you need to remember. Don't put pressure on yourself if it's not working. And I just think I really needed somebody to say that to me. And, you know, you're surrounded by professionals and they're all pushing breastfeeding. I know that it's the best. They say it's the best, but at what point does your mental health become, you know, the priority? Because at the end of the day, if you are not happy about how you're feeding your baby's not going to be happy. And so I was just really grateful that a midwife had actually come out and said that to me, and decided then that I was going to, well, we decided on a bit of a plan that I was going to breastfeed from a bottle and then top her up with formula until we could get the tongue tie sorted. And so they were actually discharged me that day, didn't they? And you came to pick me up, and we were getting ready to go. And then a doctor came to see me and said, I'm really sorry, I've just spoken to the registrar and they're not happy for you to go. And he said, I'll let you go if you want to go, but we're not quite happy with your bloods. We just want to keep you in one more night as a precaution, and you can go home tomorrow. That was, yeah.
It was sad. I mean,
I felt like everything just fell apart around me. I couldn't hold it together anymore.
I hadn't been able to be there to help. So by this point, and you hadn't really told me about what had been going on. You'd kept it quiet, probably because you thought I couldn't do anything. But that then meant that you were kind of institutionalised in this place on your own.
Yeah.
With you know, been trying to get around with this wound.
Because that's the other thing, is that you've just had major surgery, but again, I'm not saying anything, you know, I'm not saying that anyone could have done any more for me. I think it's, again, illustrates how understaffed the NHS is. You've just had major surgery, yet you don't get help getting up. I remember a few times I asked for help off the bed, and one of the midwives said to me, well, you need to put your legs over the bed, and I was like, no, I can't move.
Yeah.
So, you know, you're trying to move around the ward, you're trying to get the bottle sorted, you're trying to get the pump, you're trying to change her, you're trying to, get her to go to sleep after you've just had major abdominal surgery. And that's something that I really wasn't prepared for. So
I interrupted there. I just wanted to make that point that actually, if I'd have been allowed to stay throughout that time, then I could have done a lot of the heavy lifting and stuff like that. But actually, you got to the final day, I was there ready to take you home. You finally thought, I'm going to have some support here.
Yeah.
And then actually, you've got to stay one more night and you've got to go.
Yeah. And I mean, I had a big cry, didn't I?
I don't think you slept much.
No,
all,
you know, you don't, as you know, as some of you will probably know as mums anyway, you don't get a lot of sleep with a baby, and when you're on your own with a baby, it's just
A
not...
hungry baby.
A very hungry baby, a not happy baby. Not very much sleep at all in those 3-4 nights. Can't remember how many nights it was, 3 nights. But I sort of got myself together and thought, right, you can go home tomorrow. And and I was scared for that night as well. I was scared about the midwives coming on shift because I didn't want another night of the night I'd had before. There was some absolutely amazing midwives in that last night. So amazing. So the midwife in charge personally handed over to the midwife in charge coming on shift and said she is going to be discharged tomorrow, but we have to check her bloods before she can. So I was feeding her at 3 o'clock in the morning, and they came in and said, I'm going to do your bloods now because the lab is still operating, and then we can get your bloods back as soon as your partner's allowed to come and pick you up. So she did my bloods at 3 o'clock in the morning. By 6 o'clock in the morning, she comes back and says, your bloods are clear, you're going home today. So it was just, and I think that last night was so much better. I'd got into a rhythm, I'd got into a bit of a flow. I knew I could do it, I had a plan, I knew I was going to go home. And, you know, I felt a bit better then. So, yeah.
I think talking to the midwives about it as well, it meant that actually more people were.
Honest.
They opened the curtains for you. They were a little bit more kind of, because you were just restricted to those curtained
you couldn't
area,
even open your curtains.
which I think is COVID
Which
related,
is COVID,
isn't it?
because obviously COVID doesn't go through curtains. Which is,
but I guess it restricts people from moving around and passing each other.
Yeah.
But it meant that you felt kind of enclosed in, and I think once you'd mentioned it to them, they were like, "Well, there's no one else in this section, so we can."
No, so there were some people in that section with me. There was one other girl, and I mean, I chatted to her through the curtain. To this day, I don't know what she looked like.
No.
I wouldn't know, and we talked quite a lot because she was struggling with feeding a little bit. Her baby was, keeping her awake. Luna was keeping me awake. We were keeping each other awake. So we were chatting through the night a little bit, and supporting each other a bit. And I have no idea what she looks like because I never could see her. So yeah, she went home. Oh no, she was moved to somewhere else, and so I had this whole ward to myself. So I opened all of the curtains. I could see out the window for the first time since I got onto postnatal ward. And it did feel a little bit better, and I was honest with the midwives, and I said I had a really bad night last night. I don't feel like I was treated well. I think they could see that, and they were really lovely. So you came to get me, didn't you? And on day 4, and we went home.
Relief, wasn't it?
Yeah, and got home, and I mean the first couple of days, I mean, it was a bit of a blur now, but I remember a midwife came the next day. So a community midwife comes to visit you the next day at home, and she said, so you need to go back to the hospital tomorrow because she needs to go get weighed. And usually they would come to you, but because of COVID, I had to go to the hospital, and I thought,
that was.
I don't know how I'm going to do this. I couldn't walk. I was sleeping sitting up. Even that was really painful. I was on all sorts of medication. Your legs swell after a C-section. I think you swell because of the excess fluid after a normal natural birth anyway, but after a C-section I think it's a bit worse because there isn't chance for you to lose any fluid in the labour. So my whole waist down was swollen to 2-3 times the size. And I just thought, I don't know how I'm going to get there, but I did. Set off really early, got there, hobbled on. And the other thing is that the maternity and postnatal ward is, I don't know if you're familiar with York Hospital, but there's the entrance, and the maternity ward is as far down the other end as you could go.
The opposite side.
Completely the opposite end.
They make you drop you off at the front. Dropping you off at that front entrance and watching you slowly shuffle in was just heartbreaking.
Just had to hobble the whole way there. And I got her weighed and everything. And and I was seeing somebody about getting her tongue tie sorted.
Yeah. You walked past the midwives as well, didn't you?
Yeah, so while I was there to see someone about getting her tongue tie sorted, one of the midwives who felt really uncomfortable seeing because of that night I had in the hospital, I saw, and it just sent me into a little bit of a panic really, and I just wanted to get out of there. And then when I went to get a tongue tie sorted, the lady said, I don't want to do this. I've got a colleague who is much more experienced than me. Can you come back in 3 days?
So 3 trips to the hospital, was it?
So, yeah, and so then, you know, we went back and we did get her tongue tie sorted, and but by that point, I just didn't want to do it anymore. I couldn't. Every time I tried to breastfeed her, every time I used the pump to feed her, I just felt really emotional. I just couldn't. I felt sad. I was dreading feeding her.
You were dreading night times as well, weren't you?
Yeah, definitely had some trauma around the night times. I found that when it started to get dark, I just started to feel really panicky, and I didn't want to go to bed. I didn't want to go to sleep. I just getting up in the night as well felt really, even though you were getting up with me, just felt really disconnected from everything. I said to you the other day, didn't I, that I would sit in the room that we're sleeping in, and you can see out of our window into other people's houses at the back of us, and I used to stand at the window and watch people going about their lives because it made me feel a bit more normal, because I was watching people do normal things and having normal family life. If it wasn't for the fact that I knew that it would pass, I knew the baby blues would pass, I knew it was hormones and a very difficult time, I'd have said that I was in crisis.
Yeah.
And you know, I've been offered support. Like I said, I'm waiting to have some support for it. Feeling much better now, loads better. It was just those first couple of weeks I emotionally didn't feel like I would ever feel normal again.
Yeah.
I think that was emotionally it was the hardest. That was what I found really, really hard. And I do think it stemmed from the whole breastfeeding trauma. I don't know how much of it, you know, had that been my only night in hospital, I might have dealt with everything much better.
Yeah.
But I'd been in for such a long time for the induction, then had a C-section, then had to stay in because I had an infection for 3 further nights, had this awful night in hospital. COVID meant I couldn't go anywhere. You were allowed in for 2 hours a day, and for those 2 hours I was so knackered that I wasn't, you know, it was basically swapping clothes and food over.
Yeah.
Had, you know, all of that not happened, maybe I'd have been much better. But unfortunately, you know, it is what it is.
I think as well, when you were back, once you could start to move around a little bit, I think that helped with your state of mind, didn't it?
Definitely. Yeah. All I wanted to do was to be able to just go outside.
At one point you took her out, and just walked like around the garden a little bit, didn't you?
Yeah.
You shuffled around the garden so you could get out, and I think that mobility did come back quite quickly. Yeah.
And I do remember remember them saying to me, within a week you'll feel better. In regards to like the C-section, a week you'll feel better, 2 weeks you'll be back to normal. They say don't drive for 3 weeks, and 6 weeks is full recovery. And I remember thinking, there is absolutely no way I am going to feel anywhere near better in a week's time. Like, I felt like everything was so messed up, like swollen, sore, bruised. I still had sciatica, couldn't move, could barely pick her up. Emotional. I just thought, there's no way in a week I'm going to feel up to anything. And a week later I did feel better. The swelling had gone down. Within 2 weeks the swelling had completely gone. My mobility was almost back to normal after 2 weeks, which I genuinely, how uncomfortable. I guess what I'm trying to say is if you know you have to have a C-section, or if you get to the point in hospital and you're about to have a C-section and you're worried about the recovery, or you know, you get home and think something's not right. You know, I thought I had internal bleeding several times because of how much pain I was in and how uncomfortable things were. I guess what I'm trying to say is that it does pass quite quickly, even though you feel like there's a lot to get better within in a short space of time. It does get better. Yeah, and then I think from then on, it's just been a steady sort of improvement. Yeah, feeling much better every day.
I think the moment you decided that bottles were the right thing,
that felt like a massive weight off. Yeah, I think that contributed massively. And I have asked for a debrief at the hospital. I'm still yet to have that, just to sort of go over the decisions that were made, and so that I can sort of communicate my experience properly. I know that breastfeeding is best. I know that that midwives have a duty to recommend only natural methods and recommend the best for your baby, but I don't think they realise how damaging that can be for people maybe who can't breastfeed, or like her, for babies that have a restriction. It just has a profound effect on your mental health.
I think they need to trust that mums know it's best.
I just think there needs to be a balance. I just think, and like I said, that midwife who came to me and said, a fed baby is a fed baby. That was all I needed, was to just feel like it was okay to do something different. And I absolutely hats off to breastfeeding mothers, that it is hard. I couldn't do it. I completely admire anyone who can, and I know that there's people who breastfeed for a long time, and it's brilliant. I just think you haven't failed just because you've picked up a bottle, and I think that's really important to get across, is that you know less of a mother, and you're feeding your baby, you're doing everything you can, and that's okay.
And you can prioritise your own mental health sometimes.
Yeah.
And I think she's continued to put weight on none of the health visitors or anyone has been worried about how she's progressing health-wise, everything, so we can't see any, there's no obvious impact on her health from switching to bottles, except the whole household just seemed to breathe a sigh of relief, didn't we?
Yeah.
And I think another thing as well, just remembering that some midwives, it becomes bread and butter, I think.
Yeah, and I think that's it. I'm not saying that those midwives were horrible people.
No.
I just think we're, been doing it a long time.
Yeah.
And
maybe weren't quite realising how sensitive you were and how vulnerable you were in that position, that actually what you needed was more sensitivity, a little bit more guidance.
It was just one night for them. They didn't know I'd been there for so many days already.
No.
They didn't know that,
So I think mums should be able to feel like they can speak up, and they can ask to change midwives, and they can be honest. And I think when you were, I think that really helped your situation. It helped the midwives understand what you needed. They were a little bit more lenient with me about how long I could stay and things like that, weren't they? So always speak up. I don't feel like you're a burden. You've got a right to ask for what you need. Yeah. Thank you so much for telling us that. I know it's hard to recount it. It's been hard to it's been a hard few months, especially not these sorts of conversations you maybe would just have a few times with different people, your girls in different situations where you process things, and I think that this has just been a bit of a different way of doing that a little bit, so thank you for doing that. And we've had a few questions from people. Thank you so much for all the support, and we've had some lovely messages from people who've watched part 1, which is really, really lovely to, because this is odd for us. We do know we're sharing quite a lot, and we're opening ourselves up a little bit, so thank you for the people who've supported us. Questions we've had. What's been your favourite thing over the last couple of months?
Okay, so I think, it's just been a complete whirlwind, and everything new that she does is a favourite thing. So every smile, giggle when she starts to look at me, and holding her head up, that's all been my favourite things. But I think there's definitely been times when I feel like the day just doesn't start. We get out of bed, we don't get dressed before 12 rarely anyway. You're just trying to keep on top of things, and your house is a tip. And some days I just don't feel like we get started. And then there's other days where I can have a cup of tea that's hot while she has a little nap in the morning. I get the bottles ready. I get things sorted, we get dressed, we go out in the pushchair and the sun's shining, and I just sometimes think it's all right, it's okay.
You got this.
Things, you know, we can do this.
Yeah.
And I think that those have been my favourite times, just those little moments of everything's gone okay today.
Yeah.
Because you need those as a new mum. There's so many moments of chaos.
Yeah.
That you need those little
Yeah.
tiny good ones.
I think you're right. Okay, so we talked a bit about recovery, but someone asked, how did you find recovery?
Yeah, so I've talked a bit about that. I found it hard. I found it hard, the recovery really hard. But I think what I would say is that if I could go back and do it again, which I've absolutely no wish to do, if I could go back and do it again, I think I'd just say, you know, you don't have to get up and out and about. You don't have to prove to anyone that you can bounce back. I think now I know that the recovery was fairly quick, and I was up and about, and I was getting out on walks within a couple of weeks and beginning to feel more normal. I'd have just allowed myself that time to be emotional, to be, you know, stationary, to you know, lounge around a little bit and just not you know, let the house be a tip. I've just you don't have to prove anything to anybody, I think. So
Thank you. How did you avoid or manage your panic about labour throughout pregnancy? Oh, that was an interesting one.
I mean, I was panicked about labour. I was scared of it, through the whole pregnancy. I mean, I wasn't so scared of it that I let it take over me. It wasn't like a deep
It seemed to just
rooted
now and again you
anxiety.
think about it for a bit.
If I thought about it too much, I'd be like, oh my god, and I'd just have to move on from it. I just have to not think about it for too long. There's, you know, if the chances are, if you've got pregnant, you really want a baby, and so it's just something you have to go through. I think you just the baby has to come out. And for me, I went through the labour and I didn't even go through the actual bit.
And then at one point you thought it was going to be this huge baby, and then you were told, oh no, it's normal sized. And then when they actually pulled her out, they kind of went, oh, she is massive.
That's why she wouldn't come out.
£9, well, £8.15.
Yeah.
So, you know, I think it can be a bit of a roller coaster when you go for these appointments and finding out different things. But I think at the end of the day, when they come out and they're there, all those things kind of...
And all it is, when you're in it, when you're actually in the labour, it's just a collection of moments that you get through. You know, you don't really have time to be scared. You just think into the next contraction, you just think into the next big event, the next big
decision,
thing. And you just get through it that way. So just, I just try not to I mean, I say try not to worry about it. I did worry about it, but try not to let it take over you, I think.
And be careful about what you Google. Be careful about where you get your information from, because you can Google, what about this thing that's going on now? And then if you're not getting it from a reputable source, if you're getting it from... there's a lot of places where people go out of, you know, will just go off on one about things. And I think you need to, you know, there's NHS, there's a couple of other ones. Was it Healthline, was it? There was a couple of websites where we got really good information. We'll link some of them in the comments. Finally, there's a question. What's one thing no one told you about being a new mum?
That's a good one. I think in terms of what to expect with a baby, I think I was quite well prepared. I've got a lot of friends who are mums, and so and we read a lot as well. So I think I was quite well prepared for that. But I actually think what I wish somebody had told me, and I've read a book since having it called, I think it's Little Book of Self-Care for New Mums. My friends got me it. It's brilliant. And I read something from a mum in there, and it said, raising my non-existent children hypothetically was much easier. And what she was meaning is that don't hold yourself to pre-baby you standards. So you might think before you have a baby, I'm not going to give them a dummy, I'm definitely going to breastfeed, they're not going to co-sleep, or we are going to co-sleep. Whatever your decisions are, don't be afraid to throw them out the window. You know, if she needs a dummy, we've given her a dummy because, you know, that she, you know, sometimes she cries a lot. and it soothes her. And you know, you just make the decision that's best for you and baby at that time. Don't hold yourself to what you said before, because you just, you know, you need to navigate this tiny little human, you know, and you both want to be happy. So yeah, I think that's what I'd say.
That's good.
And know that you'll always get through whatever it is, whatever they're crying about. It'll be something different the next week. And I'm lucky now that I can. When she was really small, I kind of wish that time away to the now time where it's a bit easier and she's smiling and she's interacting. But I can catch myself now, and I can sort of catch myself being like, just, you know, your house might be a tip, but she's awake and she's smiling at the moment, so I'm going to sit and have a cuddle with her, and I'm going to play with her because
this time goes quick.
Yeah.
The weeks are flying, aren't they?
Yeah.
Thank you.
Thanks.
And thank you for watching. I'll have a toast.
Oh yeah.
Because it is Mother's Day today when we're filming this. So to my warrior, to my beautiful Anna, to the giver of life, thank you. To all you mums out there, to all you mums to be, to all, you know, to all your mums, just, you know, to everybody.
Mums that want to be.
Yeah.
All.
Yeah. Thank you so much, and all the best. Cheers. Until next time, safe travels.